Good morning, everyone. It's Tuesday, May 5th. I want to thank you so much for coming to our Food Policy for Breakfast seminar series. I want to welcome you to Hunter College, New York City Food Policy Center's third webinar. My name is Charles Blacken, and I'm the Executive Director of the Center and also a nutrition professor at Hunter College. We're fortunate to have several experts join us to discuss the impact of COVID-19 on our food system. With us today is Joel Berg, the CEO of Hunger Free America, and Dr. Ruth Finkelstein, the Executive Director of Brookdale Center on Aging and a professor at Hunter College, who is coming. She's not on the screen right now. Tony Hillary, the founder and director of Harlem Grown. Michael Hurwitz, the Director of Food Access and Agriculture at Grow NYC. And Kate McKenzie, Food Policy at the New York City Mayor's Office. I want to thank you for joining us today for an update on the teen crisis in New York City as it relates to food. And before I have everyone introduce themselves, I wanted to let you know again about a project the center is working on in order to help connect New Yorkers who are most in need to available food resources during the COVID-19 emergency. We developed 59 neighborhood food resource guides, which are updated every 3 to 7 days and can be found at nycfoodpolicy.org/food. We've been working with our partners to help compile and refresh this data, and we thank Share Meals, Beta NYC, Plentiful, City Harvest, Feed NYC, the City of New York, and of course, Hunger Free America for their constant and continued assistance in helping to create and maintain these much needed resources. We'd also like to thank all the volunteers and staff for their countless hours helping to maintain these guides, and of course, the City Council for their support. I'd like to start by having each one of you introduce yourselves, and starting with Joel, please.
Good morning. Thanks for hosting, Charles. I'm Joel Berg. I'm CEO of Hunger Free America. We're a nationwide anti-hunger advocacy and direct service organization. We don't do direct food distribution, but we help people access food resources and particularly safety net programs. And we're based in New York City. I'm coming to you live from scenic, historic Park Slope, Brooklyn.
Thank you, Joel. And also, I forgot Alexina Cather, the Deputy Director, most important, at least mentioned.
Good morning, everyone.
Good morning. Tony?
Oh, good morning. I'm Tony Hillary, founder, executive director of Harlem Grown. Harlem Grown is a youth development organization that uses urban farming and hands-on education to lead children on a more healthy, sustainable lifestyle. But we had to do a quick pivot that we will probably get into during this conversation.
Michael?
Good morning, everyone out there. I hope everyone is safe and well. Michael Hurwitz, the Director of Food Access and Agriculture Programs at Grow NYC. We currently have 19 of our retail green markets operating in 3 boroughs. We have 5 food boxes operating in 4 boroughs. We have 2 farm stands operating in 2 boroughs, and just started working on an emergency food box operation in all 5 boroughs. Look forward to having that conversation. Thanks.
Kate?
Good morning, everyone. Thank you for this opportunity to talk about this very important time and the responses and experiences that we're all having. I'm the director of the Mayor's Office of Food Policy and working directly with Commissioner Catherine Garcia and a tremendous team that is supporting the COVID food response. To date, we have almost 500 schools that are operating grab-and-go feeding programs to anybody that needs them, as well as serving, today we'll probably serve more than 500,000 home delivered meals to those individuals in need of food as well. And I look forward to chatting with you about those programs as well as many other topics.
Thank you all again. Just a reminder that we're not taking any questions. There's no chat available. If you do want to email a question, I do have my email up, and you can email info@nycfoodpolicy.org, put in all bold, question in the subject line, and we'll see if we can we'll be able to get to it. So I'd like to start with talking about food pantries. We've heard that roughly 30 to 40% are now closed at any one time, And again, I don't have the data to know whether or not it's the same 30% that are opened, or it's a mix of the 30 to 40%, excuse me, that are closed. And I'm just wondering, how can we ensure that food pantries remain open? Does anybody here have data on that, and sort of reporting on what's going on with food pantries? Perhaps Joel and Kate, or Kate and Joel.
Sure, I'll take a stab at that. You know, I have a call every Friday at 3 o'clock with advocates and community-based organizations on the city response. And I really want to appreciate an individual, important individual, Greg Silverman from Westside Campaign Against Hunger, who pointed out that actually, while the information that you just described is factually true, the bigger question is actually, of those pantries that are open, how has their reach expanded? Because many feeding operations have actually, in some cases, doubled the amount of work and meals that they're providing, people that they're serving. So I just want to recognize the sort of reframe of the question around pantries that are closed, as well as those that are also doing more. I will say, of course, that there are a tremendous number of food pantries in the city of New York. All of them are important. And for those that have had to close temporarily, whether that is to themselves practice social isolation, the city specifically, I'm not sure if my colleagues from the Human Resource Administration are going to be able to join today, but we've been able to place volunteers and help to restaff some of those organizations. Actually, and I'm reminded last night, the mayor's NYC service introduced a new funding opportunity also specifically for helping to staff organizations. So I think that, it's going to be important to look at the long haul about bringing some of those pantries back. But, thanks. I want to appreciate the New York City Council for helping to make available $25 million that is expressly for organizations who are doing food provision and benefits work and meal provision as well. We're executing those contracts right now, and the intent there is to enable the organizations who have really stepped up since March 7th, when the pause order was instituted, to be able to help to provide resources, whether it's money or food or other things, to help cover some of those costs and expenditures that they've experienced. I'm not sure, Joel, you probably have some other thoughts around that particular piece too.
Yes, thank you, Kate. So I always stress that people need to understand how limited and stretched the emergency charitable network was before this crisis. And I'm sure we'll talk more about the safety net programs and the rest of this program. But even in the best of times, every dollar's worth of food distributed by every soup kitchen, food pantry, food rescue organization in New York City is less than 1/11 of the federal nutrition assistance programs, the dollar amount of them. And so even though SNAP is underutilized and WIC is underutilized and school breakfast is underutilized, there's still 11 times more what the pantries and kitchens give out. And many pantries are run by unpaid volunteers, and they're the best people I've ever met in my life, right? The people who are walking the walk. Many are people of faith, putting their faith into action. That being said, there is no logic to this system. Right, in the late 70s, there are a few dozen of these agencies, and now there are between 800 to 1,000 of these agencies, and there is never a plan to go from a few dozen to a few thousand. There's never a governmental plan. There's never a nonprofit plan. It was just people say, well, there's a need in my neighborhood, let me do it. And so, in the best of times, you could have two churches across the street from each other, both open with a feeding program on the second Wednesday of every month from 2 to 4, and then nothing open at night and nothing open at Thursdays, or a neighboring neighborhood which just doesn't happen to have two churches that want to do this, that with nothing. And again, before this, I recently read a statistic that even though there are between 800 to 1,000 of these agencies in New York, 100 of them provide half the food. 100 of them provide half the food. And so there's very little middle class, so to speak, in the emergency feeding system. There's some bigger agencies with multi-million-dollar budgets and professional staff serving a lot of people, and then just hundreds and hundreds and hundreds of microscopically small agencies. And so I suspect, I haven't really analyzed it, the 30 or 40% of the agencies that have shut down are disproportionately the ones that were very, very small to begin with. And it may or may not make sense to use resources, National Guard troops, volunteers, grants to reopen them, or it may make sense to provide more resources in under-resourced neighborhoods. And I hope you never want to say there's a silver lining out of any of this horror. I believe the mayor is right when he said nearly, about 2 million New Yorkers are probably food insecure now, struggling against hunger. So I don't want to long for a silver lining, but if there is any, is that it sort of heightens the general awareness of the gaps in the system, and perhaps as we rebuild, we can more comprehensively and more strategically really look at the needs across the city.
So Joel, we talk about this a lot, and we're in this, we're talking about this every day. But what does that look like? Is it something like we're plentiful? Like every one of these agencies is maybe get some sort of license that's not difficult from the city of New York, and they're all connected somehow. Like, what does the ideal system look like? I'm confused.
So right now, every soup kitchen in New York is supposed to be licensed by the health department. But food pantries are technically not licensed by the city. The only time they would officially be in contact with the city is if they're getting city funding, either through the Human Resources Administration Emergency Food Assistance Program or given extra money by the city council. And the only time the state would have contact with them is if they get money through the HIPNAP program or some other state program. So I'm not suggesting every charity's got to be licensed and coordinated. I am suggesting if they get government money, they should be, and the state and city and the nonprofit sector, including the bigger charities in New York, should be better coordinating. Those of you who know me know I've been on this hobby horse for just about 18 or 19 years, and we've had some progress in it, but it should mean everything from coordinated applications to get funding. The pantries and kitchens should have one application that goes to the city, the state, hopefully for federal programs like the FEMA Emergency Food and Shelter program, and that should also be their SEMA application to City Harvest and the Food Bank and the Met Council of Jewish Poverty and Catholic Charities and the Federation of Protestant Welfare Agency. So there should be one application to get the food and funding, and then one coordinated system of monitoring. There's some of that, and there has been a coordinated food system in New York through the New York City Committee on Food Resources. But I think that needs to be more coordinated, more inclusive, and then a really fundamental look at where the food needs are. To be frank about this, we've almost treated like it's the right of a community-based agency or religious entity to have a food program. And instead, I think we should think it's the right of hungry people to get food. And the two are not necessarily the same. And again, I'm not bad-mouthing people in any way, shape, or form. They're doing incredible work. They stepped into the breach. But it does mean really looking at census data and where immigrants are and people who are unable to access these other programs, where the train lines run. You see big agencies that are sort of, I wouldn't say vestigial agencies, but as Kate mentioned, the West Side Campaign Against Hunger, one of the biggest feeding programs in New York City. It's on West End and 86th Avenue, with the exception of maybe some SROs still left on the Upper West Side. Frankly, that's not an impoverished neighborhood anymore, and people are coming all up and down the one line, traveling fairly long distances to get their food, sometimes from the Bronx or way up there in Manhattan. So I just think we need a comprehensive strategic look that combines both our heart but also our head.
So did you want to say something, Michael, or did I? So Kate, do you have an envision? I mean, are you able to take a breath to think about anything other than?
Yeah, thanks for asking.
Because I just know what your days are like, and by the way, I appreciate everybody being on here, but I just know like everybody's pulling at you.
Yes, but I think that this is the right time to think about what a new system, what an evolved system looks like. But I want to be really clear that that picture is not crystallized yet. I think that we aren't yet at the, we really don't know how long this crisis is going to last and how bad it's going to get. What I do know is that the number of, first we were focused on the city was focused on the COVID vulnerable. And then really quickly, it became clear that the new population who were food insecure as a result of COVID was vast. And then of course, there's the 1.2 million New Yorkers who were food insecure pre-COVID. So how we think about the sort of, what is the new standard of service, to Joel's point, that is about people first, organization second, is something that we're thinking through and grappling with every day. I think it's really important that we really do try and think really creatively and out of the box about what systems should exist, and not try and necessarily just rebuild a system that wasn't working to start with. But I don't have that clarity yet, because we are, there are a lot of pieces in play here. The city has stood up a tremendous emergency food home delivery system. And we don't know how long that should or will last, depending on, again, that need. So I think that we really are at a sort of new reality for how people are going to be needing emergency food, and also how we're supporting that through this very, very intractable crisis of unemployment.
Right. I'm going to read something from Stephen Ritz. I don't know if you all know who he is, from the Green Bronx Machine, and he's in the Bronx. And he wrote this to me the other day, and he says it still, seems right and accurate. He goes, right now, all of us are focused on COVID. My goals are feeding the most vulnerable and connecting youth to distance learning. Death toll in NYCHA is mind-numbing. We've had to help undocumented folks claim family members, shown up to deliver food, he's talking about, only to learn folks have passed. And even now, folks are afraid that ICE will be conducting raids under the premises of delivering food and supplies. Many of the larger stores are closed or so severely restricted in hours that many people are shopping entirely through bulletproof windows of gas stations, blowing a month of benefits on Pop-Tarts and chips. So again, this is anecdotal, but I personally trust Stephen, that he's not just, and it was sent just to me. I did ask for his permission to read it. And I just wanted, any of you to react to that. I know it's terrible, but is this going on? And, is there anything we could do, or what should we be doing to potentially correct it? And I think this is open to anybody on the panel, so I'll open it up for someone to respond to that.
May I?
Yes.
Well, Steve is he's dead on that. And it's pre-COVID. This is the whole underbelly of our society. Everyone knows the high number of homelessness. New York City has 114,000 homeless children that go to our schools. I don't know the data, I don't know the numbers, but to me, from where we are, it's a disproportionate number placed in communities such as Harlem, South Bronx, Brooklyn. You know where these shelters are, you know where these children are. Now, I'll be honest, before I started Harlem Grown, I was kind of oblivious to the plight. But now that I'm on the ground and I see this, the majority of these people are working poor. So we have these huge domestic violence shelters. I mean, we service hundreds, if not thousands, of domestic violence children. Just imagine that. Just imagine the trauma. Then you're taken from your home, you're put into these shelters. Now, you have to navigate the system. The mothers, in most cases, are working poor. Now we deem them essential employees now, right? Still don't want to pay them $15 an hour. We deem them essential employees. They have to work. These children are left home at these shelters with a babysitter or whatever babysitting or whatever kind of service they have at the shelter. A lot of these children are relying on those grab-and-go meals for 3 meals a day. So remember back in mid-March when we were all panicking, running to the grocery store, buying up all the toilet paper, bottled water, rice, pasta, beans. Our families have to wait until April 1st to get their food stamps, and they run into half empty shelves at the stores. And to Steve's point, they're almost forced to go out and buy crap and then go out to work. I mean, this system just kind of just compounds itself on our most vulnerable. And we all look for silver linings. And in the beginning, when everyone was cheering our newly essential workers, but then you see the photos of the subways today, packed still, half the people with no masks. Those are our essential workers who are going to get sick, who are gonna get into, I mean, you just see this cycle going, and I just don't know. I mean, you sit here and you just feel helpless.
Charles, can I add something? And we've talked about our food system being an extractive food system for decades and premised upon cheap labor and corporate profit. And we see the effects of that now. In terms of what Stephen talked about, I know that supermarkets have closed in Flushing, in Jackson Heights, in Elmhurst, in Corona. These are some of the hardest hit areas in our city. These are, we know, high rates of undocumented individuals where there is no bonus unemployment for them. It's one of the reasons why Commissioner Garcia has focused at least our efforts on communities such as the ones I just named, including Sunset Park and parts in North Shore of Staten Island, recognizing where some of this new hunger exists. And that's not to take away from the, like you said, the 1.2 food insecure that existed prior to now. It's also why, for the first time, we are including in the boxes that we're delivering, we're going to be delivering about 66,000 boxes and 330 meals over the next 12 weeks. It's going to be a combination of regional local food, but also some of those shelf-stable items, rice, beans. This is the type of veg-based protein or plant-based protein that we're talking about, not Impossible burgers and Possible meat, but actually beans and real protein. Rice, staple products, even shelf-stable milk for the communities that actually ask for them. Our boxes are going to be curated in partnership with the communities that we're serving, along with regional food. And I want to emphasize that regional food has to play a role here. Our emergency food system can't be based on industrial agriculture's leftovers and imperfections. Our work is we're working with one of our suppliers, Upstate Growers and Packers, and they're going to play a fundamental role in sourcing from their neighbors to fill these boxes. Because if ever we've seen how important it is to build local efficiencies and depend on local food streams, it's now.
Michael, our farmers, what is the state of farmers that you deal with? How many farmers are you dealing with now at Grow NYC, roughly?
We have about 240 that sell through the retail markets and another 60 or so that we work through on the wholesale side.
And what's the chatter?
It's a very mixed reality. You know, a number of our livestock producers and protein producers have done very well over the last couple months. We've allowed, with transparency, them to buy in from their neighbors who have either lost their markets upstate or who lost some of their restaurant sales. Again, our mission, even with our approach to our emergency food box program, our mission is always about farmer viability and profitability and equitable access to those products. That's Grow NYC's approach to our food work. We have seen certainly a drop-off in those who depended on wholesale sales, whether it was through restaurants or even institutions. Senior centers are closed in many places, right? And so we have worked to try to find alternative platforms for farmers to sell through. It's why we're going to continue, why we wanted to, it was important to us through the emergency food box program to partner with a 22 farmer co-op. Some farms are figuring out and getting creative, and others are going to suffer through the next few months and are right on the edge. I mean, prior to this, the overwhelming majority of farms are not profitable. particularly the smaller farms. If you look at the ag census, the most recent ag census, nearly 70% of farms under 20 acres are not profitable. We know that over 35% of farms, the primary farmer has a primary job that is not on farm. And the overwhelming majority of farms, like I said, about 8% of the farms in the United States are profitable and reaping about 90% of the food profits in the country. It is an imbalanced system.
Are the markets busier, but volume-wise, or?
The markets are incredibly busy. We've been trying to be really ahead of the food safety at food retail we've been thinking about these things prior to shelter in place went into effect, from only producers can touch product to limit contact, to we ended sampling and fresh servings immediately. The city has worked with us incredibly. SAPO, Parks, NYPD, again, Commissioner Garcia's office has been incredibly helpful in helping us spread out so that we can space our tents 10 feet apart, so that we can chalk out 6-foot lines every morning. And I know that it is because we've prioritized our employees' health, we've prioritized our customers' health, and we've prioritized the health and wellness of our farmers and their employees. I think being outside and with extra staff, helping guidelines, people feel a little bit safer shopping at those types of outlets. And we've done that at our farm stands and at our food boxes as well.
I would
Yeah, sorry.
I just want to add, in addition to that great work that Grow NYC is doing, as part of the Food Czar team, we have a tremendous work stream specifically on food supply. And I just want to plug, we have a new website, nyc.gov/food supply match. And that's for suppliers, particularly regional growers with excess product, to find buyers. And that can be, the buyers could be retail, wholesale, anyone. So, just following up on what Michael said, we're doing everything to try and find outlets for some of these really great suppliers of food.
And I just wanted to jump in because Ruth Finkelstein has joined us and from the Brookdale Center on Aging. Ruth, you're muted. Can you unmute your mic?
Yes.
Morning, how are you?
Fine, thank you. So sorry for being late.
No, we're glad to have you. I wanted to talk about deliveries and seniors. We've been getting emails, and again, these emails that we get, they're pretty much every day, and we're working with partners to work with the people that do email us, but they're heartbreaking, and most of them are from seniors. Many of them are from seniors. Emails like, I'm just down to 6 or 8 eggs. That's all we have. Can you help? We're afraid to go outside.
Yeah.
It seems to be a general theme. And I guess this is two or three part question, and it'll be, first Ruth, and then it'll be open up. But I also want to know, what scares me is after 9/11 and after the recession in 2008, there were years after that the most vulnerable suffered. And I have to say, even, not even me, but I look back on it and think, wow, I thought everything was great, but then realizing that it's not, that people were suffering years after. So it's a two-part question, and I'll start with you, Ruth. So what is it, what's going on with seniors that you hear? What are in the cracks and crevices and the gaps and so forth?
Yeah. Well, this is a sort of a different kind of hunger added on to the old kind of hunger, right? There were already 1 in 10 older adults who were hungry in New York. But then with really very strong recommendation that people over 70 not leave the house, you've got this whole new difficulty with attaining food. And just to to put some numbers on it, there's almost 800,000 people in New York who are over 70. Half of them live alone. So by definition, you know, you've got 450 households that live alone, of people who are suggested, you know, told not to go outside. And remember that other half mostly live with other people who are over 70, you know, their spouses. So you've got this sort of forced choice where people either need to go out to get food, placing themselves, just as the essential workers place themselves every day for economic reasons, at risk. So, you know, does this population need to? Now, there's been a huge mobilization in the sort of catering, delivering meals sector. The senior centers closed, as you mentioned. Meals on Wheels has stepped up enormously. The senior centers are delivering meals, but it's a very complicated patched together system through whose cracks many, many, many people fall, including, remember, the majority of people who aren't known to that system in any way, because until now, they were independent. And we haven't really addressed what are the systems for now and for the medium/longer term that help people get groceries who don't necessarily have computers and or credit cards and or safe to go shopping in the farmers markets or not. The idea of thinking we're gonna prepare and deliver meals for all those people is incredible, impossible, and not desired by them. What most of them want are their groceries. And we need to solve that problem.
Thanks. And I just, you know, wanted to add to this, and and I guess, you know, Kate, I do go to the Kohl's, you know, on Fridays, and this is not at all meant in any way, shape, or form as an attack of the city. I mean, I know we're in crisis mode, and I know this is difficult, but I have to tell you that, you know, I do cringe when I hear city representatives say to call 311 or go online, especially with seniors. And again, I don't mean it as a slight, but I can't help my reaction. It's visceral. Like you know, I think like, oh gosh, like to me that feels overwhelming. I can only imagine what it feels like to an 80-year-old to deal with.
Mm-hmm.
Yeah.
Well, yeah. So I can appreciate that. I also, you know, today, you know, people are getting through. We're delivering 500,000 meals today, predominantly to seniors. So we've also stood up more than 100 new workers to reduce wait times on 311. And we have an authorized enroller program. Specifically, we've trained more than 200 of the close to, actually by the end of this week, I'm sure we'll get to all of the senior centers so that they can help the seniors actually enroll in this program. So while I can appreciate that it might feel that 311 is not the most ideal solution, it's working. And we are enabling people to get meals delivered to their homes. And I also, you know, I can absolutely appreciate the comments that Ruth just made. And at the same time, the reality is seniors are going to be under, you know, guidance to you know, stay isolating for a very long time.
I know.
So while we do want individuals to be able to, you know, be able to prepare their own meals, the variety of food that we're hoping to, that we are providing is both, you know, could be meals or it could be, you know, pantry boxes. And we sort of suss that out through the screening questions because, you know, even to Michael's point, you know, about what Grow is putting into some of their food boxes. We want this to be, you know, desirable, culturally appropriate foods that are ultimately, you know, that people will eat. You know, let's be real. That's our end goal. But many can't. particularly individuals that, can't maybe open cans. Like, we're very sensitive to those realities. But, we're pretty darn proud of the system that we stood up and are serving. Our goal over the course of May is going to be 1 million meals a day. Not because that's a great
Delivered,
goal.
right, Kate? Delivered, correct?
Excuse me?
Delivered, correct? 1 million delivered.
Our TLC system. I'll also point out that on Friday, we issued an RFI, a request for information, from nonprofits who might be interested in and capable of also supplying that system, that Get Food system, so that we can be even more responsive, particularly, again, to sort of different cultures and ethnic needs that we're always striving to do better at. So I think that, again, this is, even going back to the first question half an hour ago, we can't solve for a future while we're still in the midst of solving for the crisis that we're in. And particularly for seniors, this is going to be a very long crisis where the guidance is to really remain at home.
And is the thought process, Kate, that the city sees this as a long haul, correct? Is that from what you're saying?
Particularly for seniors, this is going to be a very long haul. And also, we're constantly modeling and looking at other entities too. And so just because we appear to be coming down the hill of the curve, we're also very mindful of the next curve that might be coming.
Right.
Can I say a few words about the importance of government service? Those of us in the nonprofit sector, particularly if we have hunger in our names, people automatically treat us like saints. Trust me, we're not. Most of us get paid for our work, and yet we dismiss government people as bureaucrats or hacks. Now, I've been friends with Kate for a long time, but some of the other people working in the city I just met virtually. And I must say the city's response has been really impressive. They have done in a few weeks what normally government would take a few years to do. There have been bumps. So I'm an advocate. My job is always to say, thank you, next, what more do we need to do? And we need to recognize the immensity of the crisis. There were some bumps in the rollout of meals to seniors, but I think the administration acknowledged that and changed it. I think there was recognition we needed to dramatically increase the scale of this, and they are doing it. And most city officials, frankly, make half of what their equivalents in the nonprofit sector would make. So first, I think this is an important time to recognize the importance of public service, and the fact that we're getting virtually none of that out of the federal administration should not blind us to what is happening at the state level and particularly city level. I may have said this in the last call, but when the mayor was getting beat up for not closing schools, we said, I'm not an epidemiologist, we don't take a stand on this, but when people are dismissing his claims that if you close schools, there's going to be a mass increase in child hunger, they don't understand what you're talking about. Every day, before this, about 600,000 school lunches were served, about 150,000 school breakfasts were served. That going away, there is no easy way to replace that. So yes, they need to do more and better, and particularly the federal government, which still has not approved the pandemic EBT plan for New York State, which still has not allowed disaster SNAP in a single state in the United States. And while the Democrats have sort of kind of pushed for an increase in SNAP, that it hasn't happened, and the Republicans have blocked it. And so we need a lot more leadership from Washington, and I'll keep pushing the city and state to do better. But I think we should also recognize that government's done a pretty good job in by anyone's definition, just impossible circumstances.
Without question. I mean, honestly, it's been in the openness and the forthcoming and the discussions, and Kate, you coming. I mean, it's been very helpful, and we all know that it's not an easy and it's a monumental task. Alex, you had a question?
I think what the city has done so far has just been incredible. And I think all of us on this call would say that New Yorkers deserve food, but not just food, nutritious food. And given what we've seen with pre-existing conditions and coronavirus and the outcomes, are we at the point now where we can be paying more attention to the nutritious quality of what we're giving people in their meals? And how can we look at other partnerships? Like what you're doing with the TLC is incredible, but what are the other partnerships to both increase local economy, keep businesses, restaurants alive, that kind of thing?
Yep.
You could tell Alexina and I work together. If I didn't pause for her, that was my next question.
That's why I had to get in before you.
Yeah.
No, thank you for raising that. It is something that, I mean, you know, we've also, for many of you who do participate in our calls and who just also know the state of things, Kim Kessler is, you know, in her day job, works within the Department of Health, Chronic Disease Prevention, enforces and regularly updates the nutrition standards, and her team is very closely connected to the Food Czar team. You know, I want to say, I certainly appreciate the comments that were just made, but also we can always do better, and we're pushing ourselves to do better. The issue here is the supply. We need so much food, and we quickly stood up, I think, 25 emergency food contracts with suppliers. And some of those, you know, the pictures that have been floating around that some people have seen, those vendors were fired because they were not adhering to the standards that we needed. And we are not afraid to make those determinations. You know, also the things that are in the food boxes, they are emergency food boxes. The contents of those boxes still adhere to the city's nutrition standards. You know, but they are, you know, it might be, you know, cans of tuna, you know, some, you know, yes, there are granola bars. Yes, there are, you know, raisins and mixed nuts. These are intended to be emergency meals, meal kits. And, you know, again, it goes into that picture, that conversation about what is the future once we go to, you know, what is the steady state here? But currently we are still feeding people food for emergency provisions that they cannot go out to get other food products for. You know, we have halal, you know, for individuals observing Ramadan. We have halal options. We have kosher options. Enabling, you know, again, the amount of food that's needed to be home delivered so that we can be observant of certainly the nutrition standards, but also the cultural and ethnic needs that we have, is just, it's frankly, it's very overwhelming, but we are working, you know, the solicitations that many of you have seen. Again, it calls for the RFI that we've just released. You know, I want to acknowledge and appreciate the question also about restaurants. You know, I've said from day one that we are looking to operate and partner with restaurants. But again, for the scale that we're sort of looking to do, the logistics of that are quite challenging. It's one of the reasons why we've partnered with World Central Kitchen, with Rethink Food. And I've had, in the last 48 hours, 3 calls with the state of California to understand how their restaurant provision with FEMA reimbursements is working, to figure out if and how it makes sense for New York City to replicate. It's not at all easy to think about that, but we know that that's you know, a sector that we also want to include deeply, and whether that's done through Get Food or whether that's done through partnerships with other organizations sort of remains to be seen. But, you know, there's so much happening behind the scenes, and I'm certainly proud of the work that we're distributing every day. But we are thinking certainly about always improving the nutrition standards, and always about how we can involve particularly local businesses, and just trying to do that in a way that is that can be scaled for the size that we have. I will say one thing, and then I'm certainly going to move on. Sort of the standard of service that we're aiming for right now is a box with 3 meals for 3 days. So a nine meal box, if you will. And so thinking about also in the context of not just the logistics of delivering that, but you know, single meal provisions are really hard. That, you know, California did say the one thing that's really, really challenging right now is the container of the meals. And does it make sense to do single meal distributions? Certainly not for the size and scale that we're thinking about in the city, through the city's operation. But those are just some of the logistics involved in trying to ensure that, that when we do involve those different and new sectors, it's done in a way that that is going to work.
So do you have some numbers of what it needs to be to make it worthwhile? Like if we have
the RFI that has just been released is for 1,000 meals a day. So if individuals can, if individual organizations can provide upwards of 1,000 meals a day, we'll talk about doing business with them.
And maybe partner with each other? I mean,
Yep. Yep.
Kate, I do have a request from a viewer that's asking if you could repeat the website where farmers can
The
connect.
supply match, nyc.gov/food supply match.
Thank you. Tony and Michael, has there been, well, Tony first, is there, have you, what's your feeding situation like? Meaning, from Harlem Grown, you're growing food. Tell me what
Well,
you're doing and distributing and how that's working.
well, like everybody else, once the schools were closed and the gatherings were forbidden, we couldn't gather on our farms anymore. We were basically shut down. But the need of our families was so glaring, it was hard to ignore. So we kind of pivoted and we started a program called Harlem Helping Harlem, where us as the nonprofit, we raise the funds and then we target a local restaurant. That restaurant brings back all of his employees. We have some criteria as well, price point, be able to process these foods in a container, single serve containers. So we started with Chef JJ Johnson, the Beard Award winning chef at a Field Trip up in Harlem. And we started with one shelter. So we bought 400 meals for the families in this one shelter. And that one deed turned into, we're doing it 5 days a week now. And now we're gonna broaden it to other local restaurants. We're gonna start with Tarenga this week and Babalucci next week, and starting with all 3 restaurants. Because if you look at it, we have a price point of $12 per meal. Now we get a nutritious, healthy, more importantly, hot meal delivered 1 day a week to the shelter. So the parents come home and don't have to worry about dinner that night. Everything is there, it's fresh, it's good, and it's nutritious. So we've started this and it's become a runaway train. It's a huge success. Our families love it. The restaurants love it. And more importantly, we're feeding our families. So we're happy. So it's a win-win-win across the board.
Thank you. And I Ruth, I guess the question I have for you is, as this progresses and keeps going, is it only a upward reach for a senior to get food and get help, meaning they have to reach out, or is it happening where senior centers? How are we accounting? And this is open to anybody who knows the answer. How are we accounting for those that are seniors, and are we reaching out to them, or is it just that they have to reach outward to get food? Because some of them may not have the capacity to do that. You're muted, Ruth.
Sorry. If people are connected with the senior center already, or had gotten on a waiting list and then been enrolled, then the staff at the senior center actively reaches out to the person with wellness checks, checking on what they need in terms of food and also other needs, checks in on them in other ways. And I'll say that the enroller process and the 311 process has expanded those checks in important ways. They're challenging to implement, but very important, I think, for the well-being of the older adults. And another example of ways that the city has really responded. The problem is, how do people make themselves known who aren't known to any system? That's really where the gap is, and what concerns all of us for the long run, because I think that there are the sort of ability to patch it together disintegrates over time, and we're sort of starting to enter the medium term instead of the short term, and we're starting to see places, people who have chronic conditions that aren't being monitored and managed as closely as they should. There's a whole issue about medication adherence when you're not sort of out and about, and your patterns and your all the things that keep you on track. You're kind of in free fall from all that. And then how do you figure out how to navigate a food system, even if that food system exists? So even if it's there, how do you raise your hand and say, I need it? And I don't think we have those answers at this point. And I think that the existing senior services system is maxed out, trying to take care of remotely people that they're used to caring for in a very high touch service model.
Thank you.
Add something. You know, some of the partners we're working with, like the Red Hook Initiative, you know, who early on went out and organized and did comprehensive assessments of tenants of Red Hook houses, from medical needs, dietary needs, so they could really focus a response based on what their community needed, and with a thorough understanding of their community. We're working with United Sherpa Society. Right? They knew who was home and who was sick and who couldn't come pick up that day. It's refreshing to see the city's response this time as compared to Sandy, because they see these small community-based organizations as essential partners who know their communities better than anybody, and who have the expertise on the ground. And I hope that it's these organizations also who continue to be invested in when this is over, who are seen as first responders, and who are truly making such a crucial impact, which is why the RFI that went out yesterday was great, was wonderful to see. And it's why, you know, the flexibility we've been able to use with some of the city council funding to actually shift directly to support those community groups on the ground has been vital to this work. So I think those are some strategies that we can take from this experience and continue to apply it.
And I know that the city is distributing masks. I've seen that. Has there been any effort or has there been any discussions that anybody knows of on this panel about regulations related to masks and protective gear for food service workers? And I know the state has a regulation for people to wear masks when they're in gatherings, but there's nothing specifically that potentially that the city is talking about. And I guess this question is for Kate, around protective gear for restaurant workers, or am I missing something, or that's already in existence? And if so, where are they supposed to get those masks? Can they go to the city to get them?
So the city is, I will say all employers are required to provide PPE to workers, and workers should wear them unless they have some, type of medical reason that would prevent that. The city has helped to facilitate some PPE purchases. And, it is becoming more and more available, whereas, a few weeks ago, it was incredibly high demand. We are absolutely providing PPE to all DOE workers at grab and go sites. But we have helped to facilitate PPE purchases when we've been asked to do that. But yes, the guidance, I believe it comes from the state, is that all employers are required to provide PPE and workers should be wearing them.
But nothing specifically for restaurants. As restaurants reopen, I guess I have some concerns, about that. But I guess it's sort of the buyer beware. Or
well, I think we need to wait and see for when that happens and solve for that then. I think, it's likely that restaurants are going to determine how to keep certainly their workers safe, their customers safe, and customers are going to determine where they go. And the state's guidance says face coverings are required where distancing is not possible. And, I know that, again, health department has issued all kinds of guidance and will continue to do that when restaurants are ready to reopen. But, just from my personal reading about when that's going to happen, I don't think it's real soon.
Thank you. I have one question about CSAs. This is from a viewer, and then I'll wrap it up. So just because I do want to end at 10:30. The question is, I run a large CSA in Brooklyn. We've been operating out of a public school for 18 years. We have enormous challenges finding a site this year, and know that it's true for other CSAs. Our school can't let us in and not sure we how to get a permit from the DOE. I'm working my way through various city agencies, parks, nonprofits, local business improvement districts, you know, and basically to help find a site for this CSA distribution. Even as interest in CSA is surging, we're also experiencing more members eligible for SNAP benefits than ever before. So we're earmarking most of our funds to subsidize these members. But this hampers us in finding a location. And basically they were saying, any ideas? And I know that Alexina is connected to this space, and we only have a couple of minutes left. Any suggestions or discussions around CSAs that anybody can offer?
I mean, the only thing that I can say is that some of our fresh food box sites actually had to relocate. And it's on this Saturday, we'll be on Lewis Avenue at the corner of Lewis and Decatur, outside in tents, packing boxes. We are now pre-packing everything. Our members are no longer bagging, and it's a system that's complicated, but it's working. And we're happy to share any resources we have around the systems that we put into place, whether it's through spacing out in lines and distancing, or how we're practicing our own distancing while packing those boxes. Send an email to Grow NYC, and we're happy to share any of those resources. As far as a space, I don't know that I can help with a space, but you can get pretty creative outside.
I just say that if a CSA is a legally constituted entity, meaning it's got a 501c3 status or is affiliated with a fiscal agent, the CSA can legally accept SNAP benefits. We've done that before at Hunger Free America when we ran the CSA. If anyone has any questions about that, they can email me at jberg@hungerfreeamerica.org.
Thank you. And I guess I do the last comment that I want to make is to thank you all today for coming. I know you're all incredibly busy. I do like to end on time, and thank you for a fascinating talk and discussion. I know we could go on probably all day and take questions from people all day, but everybody's got to get back to work. Please make sure to check out nycfoodpolicy.org. Make sure to sign up for our weekly news digest and check out our site, which has news articles every week. Also, we have two events that we're discussing. One with Stephen Ritz in an unfiltered discussion. Another is on restaurant workers and restaurants reopening, which we know is in the near far, not the near. But we do look forward to those discussions. And again, thank you all for coming today. Yes.
Thank you.
Thank you.
Great day.
Hope to see you guys in person soon.
And Charlie.
I'll let you know when we have our first event.
All right.
Take care, everybody. Have a great day.